Hello everyone and welcome to this Health ABCs video on carpal tunnel syndrome. Today we're going to talk about what carpal tunnel syndrome is, some of the symptoms associated with it, and some risk factors and ways that we can prevent it. Then we'll talk about ways we can treat carpal tunnel if we weren't able to prevent it, and lastly, I'll show you where you can go to learn more. But before we can get going, I want to inform you that this talk is created by a medical student solely for the purpose of patient education and is not to be used as medical advice and does not replace seeing your doctor. If you think you have carpal tunnel syndrome, schedule an appointment with your doctor. So let's talk about what carpal tunnel syndrome is. In order to do that, we should learn some very basic anatomy and physiology. It's important to know that when we want to move a muscle, an electrical impulse is carried by a nerve to a muscle fiber that the nerve is connected to. The nerve contains the basic instructions for how to move this muscle in the way that we want. In the picture above, the nerve is the yellow object branching out in this person's palm. En route to the muscles that it touches, this nerve, called the median nerve, travels with some tendons in our wrist through a small tunnel called the carpal tunnel. The top of this tunnel is covered by a thin piece of fleshy tissue that crosses over that yellow nerve seen in the picture. It's labeled as the transverse carpal ligament. Carpal tunnel syndrome occurs when this space gets compressed, causing the nerve to get damaged and result in the movement information that the nerve carries to be lost as well. Many patients with carpal tunnel have pain, numbness, and tingling over the part of their hand, shown in blue here. Patients can often describe this feeling as a pins and needles sensation that is similar to the one we get when we lie on our arm for too long and it goes to sleep, or is sometimes called a dead arm. In really severe cases, patients can actually have the muscles around their thumbs weaken and become smaller from the loss of use. This is called muscle atrophy. There are a couple of things we can do to decrease our likelihood of developing carpal tunnel syndrome by watching our weight and controlling our blood glucose for those patients with diabetes. We are less likely to develop carpal tunnel syndrome. There are also a few factors that have an increased association with developing carpal tunnel syndrome, including pregnancy, hypothyroidism, rheumatoid arthritis. Lastly, if you have a profession where you are constantly moving your wrists more than 20 hours per week, you may want to watch out for the development of carpal tunnel syndrome. If you think you have carpal tunnel, you should make an appointment with your primary care physician. Before your doctor decides how to treat you, they will analyze the nerve and see how it is functioning. For patients whose nerve still functions normally and they have mild symptoms, splinting the wrist in a neutral position with a brace at night, as well as injections with anti-inflammatory steroid medications, have been shown to be effective. For patients whose median nerve has become weak and doesn't conduct electricity like before, surgery will be the first-line therapy. Your surgeon will cut the transverse carpal ligament and relieve the pressure on the nerve, improving symptoms in 70 to 90% of patients at 1 year after surgery. If you'd like to learn more about carpal tunnel syndrome, feel free to visit any of the sites listed here. I hope you found this video informative and you were able to learn something today. Please check out our other Health ABCs videos if you'd like to learn more.